Good morning, good afternoon, good evening, or indeed good night, depending on when you're watching this webinar. This session is entitled Witness Statements in Clinical Negligence Claims. My name is David Pilling. I'm a barrister at Liverpool Civil Law Chambers in, surprisingly enough, Liverpool. The vast majority of my practice these days is in largely claimant clinical negligence claims. Probably about 75% of my practice is clinical negligence. I do a little bit of defendant work in terms of advisory work on the Isle of Man, so I have at least a little bit of perspective of both sides. But I apologise, given the preponderance of my work, that there may be an unconscious claimant bias in some of what is to follow. It's a half-hour session. I may go fractionally over. It's not absolutely precise. Once the session is finished, then a couple of things will pop up on your screen. Firstly, there's the obligatory four multiple choice questions in order to prove to whoever needs to be proved to that you've listened to this. It's very straightforward. They are multiple choice questions. The answers are as simple as A, B, C, and D. And then there'll also be a feedback screen for you to give your feedback to MBL, which they and I will be very grateful if you could take a moment to complete. So with that introduction, let's move on to what I'm going to talk about in this session. And we're going to look at the sort of following topics as they affect sort of witness evidence in clinical negligence claims specifically. Firstly, we're going to look at how is witness evidence, both written and then obviously oral evidence on the back of witness statements, assessed by the court in clinical negligence cases, because of course that is a sort of foundation stone for how to approach what needs to go in and into witness statements, and also at the time that they're either being written or you're looking and reading at the other side statements, assessing the strength of those. When in the proceedings to draft witness statements. And then, of course, as part of when to draft statements is, of course, who needs to give witness evidence, where there might be multiple caregivers, or on the defendant's side, where there may have been a large number of individual clinicians involved in a patient's care. Then we're just going to look at one or two factors specific to defendant's witness statements and the question of what is or is not opinion evidence, and therefore the proper boundaries of clinicians' witness statements. Very much going back to the sort of claimant side, we're also going to look at the perennial question in clinical negligence cases, and this will crop up in one or two of the other issues we'll look at. So the medical records versus a person's recollection of events, and just a recap of some cases that touch on or have as their cornerstone in terms of decisions made in the cases, those type of issues.